With us all morning long is Laura Tamblyn Watts, who's the president and CEO of CanAge, which is a national seniors advocacy organization, and she's in Whistler, BC for us this morning. I'm just wondering if we could just focus on that Dorval episode again, Laura, the most shocking that we've heard to date, and particularly the fact that people have actually been abandoning the residents in that facility. What is your reaction to the story overall?
It was just, it's just terrible. There's nobody that can say anything else. But it's important to remember that there were red flags with this home that were ignored. There were red flags from the ombudsman. There were reports that they had been doing a poor job when it came to health and hygiene. And so what we're seeing is, these terrible, terrible circumstances showing behind the scenes that really there's not the support that we need in long-term care when there are red flags for them to fix them.
I want to talk about your suggestions for fixes in just a second, but more on this notion, this is the worst that we've heard to date. It's probably not the only dire situation. To what extent do you think we know, Laura, the full extent of the problem, the full extent of the numbers of COVID-19 in Canada's long-term care facilities?
When we do testing in many provinces, we only test up to 3 residents to see if they have the disease. And that's a holdover from how we test for flu or other types of transmittable disease. It's not required by law, but it's just kind of policy for how they do it. But because it's sort of 7 to 10 times as infectious, 3 residents, if you have 3 residents, you're having almost everybody who's infected. And that data has been borne out by the few places where they've actually done robust testing all the way through it. And we have ward rooms in some cases where 4 people are in a room with only a curtain dividing them. You may have somebody healthy next to somebody who's asymptomatic but starting to get unwell. We're getting to somebody who's extremely unwell. And in some terrible circumstances, there's people who've passed who are being left in their beds.
You just can't even fathom that. So are you suggesting then that the numbers, we already know the prevalence in long-term care facilities, it's actually, the spread is far greater than the numbers that we have so far?
It's enormously greater. In the community, we think about, if you know 1, it's probably 10. In long-term care, if you have 3, it's probably just about everybody.
Just letting that sink in for just one moment. You have been making urgent calls for reform as the story has been intensifying in long-term care facilities. At noon, we have always a public health officials news conference, Laura, and we understand that this morning, one of the things they'll be addressing is, in fact, long-term care and care for Canada seniors. What is critical help to get to them right now?
They need to transfer the funds. We've been so remiss in getting our guidelines out to long-term care. The World Health Organization had the technical guidelines out a week and a half ago, and the federal government in Canada did nothing with regards to it. What we need to make sure is that they actually transfer funds to the province so that we can actually fund the long-term care system properly. It has been held together with wire and duct tape for so many years. And now, under the pressure of COVID, we just can't get the type of care we need without that transfer of funds. And with that transfer of funds, we need to regularize staff, get the PPE in, and resume robust testing all the way through. And that needs to be done urgently.
A question from Paul McCarthy, number 1. He lives in a seniors building, which is all private apartments. 32 people in this facility, and Paul writes that all of them except 2 people go out only when absolutely necessary, and then the other 2 go out every day of the week for no good reason for up to 8 hours a day. Here's his question. Is there any legal way to put a stop to this very dangerous behavior, because he's concerned they're putting everyone in this building at deadly risk?
It does depend a little bit on what jurisdiction you are, but in many provinces across this country, you actually can call a hotline to get some reaction and support from either police or, in fact, even at the municipal level, there's ticketing going available. It is a really very concerning practice. We see that Paul is saying that, the great majority of people are doing what they're supposed to and staying well. But if you have a few people coming in and out, and again, in this case, sort of 8 hours a day, they are putting the rest of the group at risk. So I think in this particular circumstance, you may actually first try to confront the person or have somebody at the front desk try to make a request. But if not, you may need to call your municipality or your local police to report them.
A question from Patricia as well, wondering if long-term care facilities, Laura, are under any obligation to inform you of any COVID-19 cases within the facility, inform you of the patient or the patient's family.
It depends on each province. There are certainly guidelines about informing people, but we see sort of a twofold problem. Is there a legal requirement that they do it? Not really. It depends on what the order is in each province or territory. So if the order that's come down from the chief medical officer is to do that, then there will be the requirement. In absence of it, there's usually good protocols for other types of outbreaks. So it may be a protocol that happens at a city level or at an individual level. Is there a legal requirement? It can kind of change. What I can say is organizations have been coming together, and Ontario Family Councils Ontario, which is a wonderful not-for-profit, and CanAge have been putting together a series of tools that long-term care homes can post on their websites, or if they need to, post on the doors that can answer questions. And certainly that's one of the very first questions that people want answered. The corollary document would be a checklist of key questions that individuals will ask the long-term care home. So it does depend, but certainly it is the most critical piece of information that we need to get out.
I mentioned, Laura, earlier in the program that not all of our questions need to focus on the spread through long-term care facilities. If you have any other questions related to seniors' issues, you're welcome to ask them this morning, too. And we have a question from Alray who wants to know this. Alray, a senior himself, he's been isolating for 30 days now. He goes out at 7 o'clock in the morning, so hopefully he's back in and hearing us answer his question. But once a week, sometimes every 2 weeks to get groceries. But again, very much following the rules. He's coping, but it's hard. He reads, he's learning to play the ukulele, and he's doing exercise stretches by DVD. But here's his wording, Laura. It's very lonely. How do I stay positive when the days are blending into one?
We know that mental health is a critical aspect of well-being for everyone. And we know that isolated seniors are especially vulnerable to depression and anxiety. And I mean, it's reasonable. It is a depressing and anxious time for anyone. But if you're living alone, it's that special aspect of disconnect. So some practical advice. Sounds like he's got a bit of a routine, which is good. Daily routines are important. If you have the opportunity to sit outside in the front of your house while socially isolating on your porch, if the weather will allow you and your house will allow you, great to sit on your porch and wave at people and have a hello. Some people are passing by, even just to get some fresh air. If you can, phone calls are great, and lots of volunteer organizations can hook you up with phone calls. Across this country, 211 will help to route you to local agencies and organizations that can help with social isolation. So there are resources. It sounds like you're doing the right thing, but more can help.
I was just, you're right. I mean, the organizations, people are phoning adopted grandparents just to give them a little bit of a boost. I was reading in Calgary, high school students have put together a hotline message for seniors to call, and there are things like jokes and little conversation they can have. People are understanding the impact of this isolation for Canada seniors. All right, I want to get to 3 final viewer questions. This actually is a list of suggestions from a couple of viewers, Laura, Shirley, and also from Catherine. This is what they say they would like to see, and I'm interested in your perspective on this. They would like seniors advocates mandatory in every home. They would like a doctor or nurse practitioner on site to monitor residents. They would like to put a stop to shared rooms and have at least, 1 room, 1 bathroom per resident, and also a snitch line. Now, that's controversial for many, but where the PSWs could actually report any sorts of unsafe practices or abuses. Those are all wish list for those 2 of our viewers. Practical, what do you think?
Well, let's start a couple of them. Let's start with shared rooms. I mean, that's very much a personal choice. It's kind of like going to a dorm room at university. Some people actually prefer to have roommates because it cuts down on isolation and loneliness. So that is a personal choice. Certainly, to the degree that new long-term care homes are being built, they tend to be built with individual rooms. But again, what we really don't want to see are the ward-based rooms where there's 4 people to a room and only a curtain between them. So 2 rooms is a question. When it comes to some of the other questions, the seniors advocate, absolutely. In fact, we need seniors advocates at all levels. The federal government doesn't even have a seniors advocate or ombudsman. Some provinces do have them, and where they have been in effect at the provincial level, there's been a really helpful set of changes. At the individual long-term care home level, certainly other countries do have an advocate or an ombudsperson per long-term care home, and it generally can work very well, particularly if they're skilled in some type of mediation or conflict resolution, where people get worried or upset with their long-term care home. You need to resolve the problem. Like, litigation's not going to help. You usually need to make sure that people stay there. So practical advice, yes, some changes we need to see as well. But remember, individual people have their own preferences on some of these issues as well.
That is an important thing to keep in mind. And of course, money available, that's a big factor in a lot of these decisions as well. So doubtless part of the conversation when we come out the other side of this and look at the broader issue of long-term care in this country. We also have Marie-Lise, who writes that she's in Laval, Quebec, which has been a spot we watched. One of the seniors residents there, Saint-Dorothée, is in, unfortunately, very bad shape. 75 years old, she's in good health, and she lives in a seniors residence. She's wondering, Laura, whether she should perhaps not renew her lease and instead move into a regular apartment building or a house, because she's afraid of becoming infected. The incidence in a residence might be far higher. So what's your advice on whether living in a senior's residence or regular building might be better?
Well, it's an excellent question. I mean, it really does depend on what's happening at that individual home. If you have a home that's not taking its precautions, that's not keeping well, the cleaning is not there, then really being in a more individual environment is better. But if you're just transferring a group environment of older people in a retirement home to another group in an apartment building, it's not really that different, except for the fact that there's not perhaps the care provision. And you'd have to, again, purchase the care provision, which means people are coming in and out of your house. So you're going to have to make your own decision on regards to that. Certainly, the critical piece here is staying well, staying healthy, and where possible, staying physically isolated. No matter where you do that, if it's a retirement home or in the community, the result is just really the same.
And final question from Daryl in New Brunswick, Laura. We've been talking a lot about if you're able to care for your frail elderly relatives at home. You might be looking at a time perhaps to pull them out of the facility in which they're living. And Daryl is wondering, is there anything legal that he needs to do if he wants to remove his mother from the home where she is currently staying?
Daryl, great question. So the first piece that anyone has to think about is their loved one capable of making their own decision? So it is true that about 90-ish% of people who are in long-term care across this country have some form of cognitive impairment, but they may still be able to make a decision on their own. So first off, don't yank people out who can make their own decisions. If they can't make their own decisions, you have to make sure that you have the legal authority to do that. In most provinces and territories, it's going to be called something like a power of attorney for personal care. In BC and the Yukon, it's called a representation agreement. In Nova Scotia as well. That's a document that the person who is capable made while they were capable, that comes into effect to pick somebody else to be your decision maker. So Daryl, if you're the decision maker from your mom and your mom is incapable, then you get to make those decisions. You are going to need to have the actual document available. In other jurisdictions or in places where powers of attorney, you don't have one, you may have a default substitute decision-making list. New Brunswick has updated some of their decisions. You can reach out to the public guardian and trustee of each of your provinces and territories to find out if, as a default decision maker, you have the right to make that decision. But again, is your mom capable of making her own decisions? Because she gets to decide if she is.
Thank you to all of you sending those questions today. They're excellent as always. And Laura, our final conversation this morning, but we greatly appreciate again your sharing your expertise with us in this very timely conversation given what is in the headlines particularly today. Thank you, Laura.